kitchens. We are a local nonprofit that serves children through school lunches and breakfast. And simultaneously, we do workforce development training for those in community to learn how to cook and bake in our kitchen. Um, it is confirming that I've made the right choice. Moving from healthcare administration and compliance to running this organization, it is very confirming that this is the work that God has chosen for me, because we get to change people's lives every day. A lot of the people that come into our kitchen are the same people that need the services that we provide. So it's helpful for us to create a warming, loving environment for those in community that don't necessarily have that even at home. And then we also make sure that those that are food insecure get to eat at least once a day in our kitchen. Here of late, we've been sending meals home with some of our staff as well. So it's just affirming to know that we're on the right path and that all of us are in the right space doing the right work for our community.
Hi, everyone. My name is Emily Ailey. I am the community outreach staff for Known and Grown. Known and Grown works with sustainable farmers within 150 miles of St. Louis. I know Known and Grown's been involved with the collaborative for a while now. I personally am new. I just started a couple months ago, so still learning everything, still meeting everyone here. But happy to be here and make these connections. And personal joy that I've had recently is I moved this year and I just harvested my first batch of compost in my new place and it looked great. And then I made sort of a little ramshackle cold frame out of a raised bed with a window on top and planted some greens. And we're going to see if it works. Hoping to be able to harvest some stuff through the winter, but I've never tried it. So I don't know if it's going to work out.
Good morning, everyone. My name is Jamie Saunders. I'm the Community Program Manager for the St. Louis Area Agency on Aging. I just love doing that. I work for a great organization. We serve older adults in the city of St. Louis, age 60 years of age and older, and persons with a disability 18 to 59. Just to give you a little shout out on SLAY, during the SNAP crisis, we were able to serve 3,325 emergency meals to older adults in the city. We also worked with, got a semi truckload of food, and we were able to deliver 965 cases of box food to 10 senior centers in the city. And we also partner with Hosco, and they provide fresh vegetables share box to city residents. And I think that's all that my boss had told me to say. But a personal joy. Well, I'm sure none of you in this room know I have a child who has a verbal disability. She's an A honor roll student, so don't get it twisted. Intelligence has nothing to do with her stutter. But one of the concerns of a mom that has a 16-year-old with a verbal disability is driving. So there are a lot of articles out there about people driving with a stutter that have been accused of being under the influence of intoxicated, disrespectful, because often to feel comfortable, they look away to speak. So I went to go get her permit. Sorry, this is a long story, but this is so exciting. So Annette said, can you put something on her license so the popos know that she's a person of stutter? They was like, no, we don't have that. I was like, oh, you will have it by the time she turns 16. So I got on the computer, sent out a few emails, and this August, 8 days after her 16th birthday, Missouri has a symbol, a red cross that says speech impaired, that you can get on the front of your license. It's open for all ages. So if you work with older adults or anyone, Google me, child. I'm on there. That I'm trying to spread the word that you can get this now put on your license. So they can be treated with dignity and respect while driving.
Wow, it's tough to follow that. So, good morning, everyone. I am Derek Hashimoto. I am the Healthy Eating and Active Living Program Manager or Project Manager for BJC. So, something that is coming for 2026 is I'm working on our goals for next year. So, really excited to continue to collaborate and meet with folks in the community. I see a lot of faces in the room that I know, so it's great. But that will help kind of drive what we want to do for 2026 for the health system. So please, I have my business cards here that if you have not reached out to me or are not familiar with my email, I will provide that to you all. Let's see, Joy has not happened yet. So my family is coming into town for Thanksgiving. So I will be hosting them. So that is a joy to come. And what else is that? The mission moment, or what was it called? The professional affirmation. Let's see. So I was in a fellowship recently, and I think one thing that struck me is that we were all in the room, and some of us have challenges of not feeling like you're good enough or that you have to do more. And I think the one thing that was stated is that you made it, right? So you're in this room together. We're all in this room together. We're all doing that mission, just like Keisha said, right? And that was affirming. And so I feel like, we all made it, right? In the work that we're doing and to support the lives of our community. So congratulations.
Hi, my name is Lauren McQuaid. I am a Master of Social Policy student at WashU, working as a research assistant with the WashU Center for Public Health System Science. What else? A personal joy. I have been making an effort to spend more time with my friends and family recently, and that's been very nice. Updates, I started 3 weeks ago, so I don't really have any updates, but it's been really cool to be a part of this work.
Hi, everyone. My name is Lacey Cagle. I am the executive director at City Greens Market. We're a nonprofit grocery store in Forest Park Southeast. We've been around for 17 years. I've only been there for 4 years, so there's a lot of work that was done before me. We work with local farmers and food producers as much as possible and sell food at cost to try to make it affordable for everyone. We have a lot of community support. We always have community support, but we particularly have community support for people who aren't able to access SNAP benefits, which we're still seeing the effects of that. So we actually have pay it forward bags. So like somebody will pay $25 for a bag of groceries, and it's just at the register. So you can take it, no questions asked, and get $25 worth of groceries. And we do double up food bucks. So if you're using SNAP benefits to purchase food, if it's fruits or vegetables, you can get twice as much for the same price when you shop with us. So please let people know about that. I feel like it's really important around the holidays and everything. So there's a lot of things that we offer outside of just providing food at cost for folks. Personal joy is definitely my daughter. I have a 5-year-old fiery redhead, and she's in kindergarten, and just when life feels so dark, it's really nice to have someone who makes you laugh and says cute things, and in the way that she sees the world, and like what a privilege it is to get to be witness to someone else becoming more and more themselves throughout the years. Like parents say all these things and you don't really get it till you're there, and you're like, wow, they just keep getting cooler. Like, yeah, like I maybe missed her as a baby, but like, man, 5-year-old Ursula is just so super cool, and professional affirmation, which is also personal joy, is, a lot of times we're talking about the work that we're doing, and we have to like let everyone know like what our outcomes are, and that's super important. That's why we're doing it, so we keep doing it. But I just feel so honored to get to work with other people who really care about our community and who are working with everything in them to try to create the world that we all want to live in. And I get to have those conversations with our staff, with our board, with our community partners, with networks like this, of people who like care so much, and who are really trying to create organizations that both internally and externally are creating the world that we want to all be a part of and that we want our children to grow up in. And that's really amazing, and I'm very thankful for it.
Hello, everyone. My name is Eric Helmer. I'm the community planning manager at TrailNet. TrailNet is a nonprofit that has been around since 1988, focused on creating safe streets and recreational trails and just places for people to be able to get out, be active, and be safe in the greater St. Louis region. I've only been with TrailNet for a little less than 2 years, so a very small fraction of that 30-some years. But the work I do focuses on community planning. We try to partner with different communities and educate them on what's happening. It's, as many of you or all of you maybe know, very confusing what's happening in the world of transportation planning and construction and things. So we're trying to, inform people and also listen, do a lot of listening and try to elevate those voices to the people, the decision makers, the planners, the engineers that are making some of these really high impact decisions that affect people all over the place, right? And we do a lot of policy and advocacy work, and also we organize bike rides. We teach kids how to bike. We do a lot of bike education with adults as well. It's a little bit of an outlier in this room with so many of you doing great work in the areas of nutrition and food. But I'll do the sort of professional personal affirmation first, and I don't get to take a lot of credit for this, but this line of work takes a very long time to see things come to fruition. When you're talking about planning, you're talking about decades sometimes for when you start things to get them finished, and it takes a lot of energy and a lot of work to keep that momentum going. And this year, TrailNet has seen a couple big projects that we got started back in, I think, 2015, actually being built out in the city of St. Louis. So Tucker Boulevard, you see downtown, they're implementing bike lanes, pedestrian safety, better transit access infrastructure there. And then the Tower Grove Connector Phase 1 is underway as well. So we're really excited about that. Again, I don't get to take personal credit, but it's an affirmation for me to continue doing, what feels like banging your head against the wall sometimes. It does take a long time, but it does happen. And for personal joy, it's only partially joyful, but a month ago, I participated in a challenge called 24 Hours from Home Challenge. And it's an international thing. It's to see how far you can get from your front door in 24 hours on your own 2 feet. And I said, I'm a runner. I set a goal. I want to run further than I've ever run before for this event, not thinking about winning or anything like that. And I ran 67 miles from my house in Tower Grove South to Litchfield, Illinois, over the course of 24 hours. And that's where I say it wasn't all joy. There was some pain and misery involved, but it was really, it was a great personal challenge. And it was also a community thing. You get together with other people and tell stories about your own crazy adventures that you had over those 24 hours. So yeah, it's great to be here. My wife brought me Chinese food at night, and I did have a friend run with me for a little bit, yeah, but mostly. I know, well, I had somebody say, run, Forrest, run, at one point. I don't think the beard is doing me any favors there, but yeah, it's wonderful to be here with you all, so thank you.
Hi, everybody. I'm Sam Pounders. I'm also with TrailNet. I just joined in July, so I'm still really learning the landscape. And I'm a community mobility planner, so I'm primarily working with our Safe Routes to School program, which is basically developing better transportation plans for students to get to school on foot or by bike. So that's been actually, again, front loading the professional affirmation. I studied landscape architecture, horticulture, and it's a really interesting full circle moment to be in like a food space. And I have worked in nonprofit in Columbia, Missouri. I don't know if you've heard of the Columbia Center for Urban Agriculture, but I worked with them as a Vista many, many years ago. So it's great to kind of see that my work at TrailNet can encompass so many things. That feels really positive for me because I returned to St. Louis about 10, 11 years ago, and it's taken a while to find the space to be in. And then a personal joy, I gotta say, I know it's not that popular of an opinion, but I love this season. I love the fall. I love the colors. I love the harvest. It feels good outside right now. It's a little dreary, but it's a good time of the year. So thank you.
My name is Mitch Pearson. I'm with 5 Global Farms in Spanish Lake. What we do, we work in the communities. We teach sustainable farming in churches, schools, and community garden spaces. Probably my best affirmation professional-wise is that yesterday in one of our schools, we have about 6 classes that we teach in. And I had a 3rd grade group come up and say, well, when are you coming to our class? You know, it was like a demand. So today I have to go over there and say, okay, here I am, you know. So this is our 8th year. And what we've done, we've converted clay pretty much to loam. That's a feat. It's a big time feat. So that's what we're working on for this year and continuing. Probably my personal joy, I'm a farmer, I love farming, and I saved my greens this year. When we had that 28-degree weather, I covered them up with plastic, and they're about as long as this room is right here, and about this wide. So I'm covering up with plastic.
Can Mitch speak into the microphone? We can barely hear him.
Oh, you can't hear me? Okay,
now we can hear you. Thank you.
So anyway, we've saved all the greens, and then this past weekend, we had a church come over, right, for like a potluck, and they picked greens and had all this food, so that was a big joy for me. So.
Good morning, everyone. My name is Joyce McCrae Pearson, and this is my lovely spouse, the love of my life. He means everything to me. I love him so much because we've had so many wonderful experiences. Recent personal joy, I love going to a little place, a little suburb of Houston called Cypress, Texas, to visit my 3 grandchildren and my son and my daughter-in-law. So that was a recent personal joy. And, you know, I was going there often and, you know, sleeping on this bad bed in the den and would come back with a backache. But it has been so worth it to watch my grandchildren grow up. It's been fabulous. Recent professional affirmation. Now, this is kind of silly, but we've had, and some people are in here, I don't want to name names, it's Dr. Jolly, he's gone, but we've had volunteers come out to the farm to help us do all sorts of things, clean up, rake leaves. And one of the things that is a professional affirmation for me, and as farmers and educators and all the different things that you do, all of this takes patience. Some things take 6 months, some things take 6 years, some things take 10 years, some things take 60 years, and your next generation does it. But we finally got this really bad chicken coop thing cleaned up because that thing was driving me crazy. I would look out there and say, what is all this about? And we had a wonderful volunteer come out and help us get that place cleaned up. Some more volunteers came and did some other cleaning. So thank you in the universe of volunteers for all of your help. And there's volunteers in here. I'm not going to name names because I'll leave somebody out. Thank you.
Thank you so much. Well, I'm Diana Parra. I'm one of the co-leads of ETC, along with my amazing co-lead, Brittany, and she's actually one of my joys. And I'm gonna get emotional. I was like, I don't want to cry. It's been a tough year, as many of you know. And I think last week, oh no, it was this week, right? I received a prize from my HN for being a health equity champion. So professional affirmation. A joy literally just happened this morning when you told me that 2 years ago when we did the retreat at MFH, I brought a DJ, Alan, and Jamie asked him to be the DJ at her wedding. And so it's just those connections, you know. I'm a weaver, and I love seeing so many of you here, and I'm so thankful for all the new faces. And I'm gonna stop because I'm gonna keep crying, and I didn't want to cry, but I'm crying because of joy. Yeah.
Hi, I'm Tina Day. I'm from Washington University. I I'm the lab manager for the Center for Healthy Weight and Wellness, and we do eating and weight-related disorder research. But here today, I am as part of the REACH project and program that's going through the Promise Zone, and I'm very excited to be here and meet all of you because I've heard so many things about the good work that this program does, and we want to be part of it. So nice to meet you all. A personal joy is my mom got her latest scan back for her lung cancer, and no change. So that is, you know, every month, every 3 months is a joy for me to have her still. So that's it. Thank you.
Good morning, everyone. I am Marissa Hardwick, and I don't want to spill a resume, but I want you to make you aware of what I could provide as a resource. So today I'm coming as an ETC member. However, I also am the Community Partnership and Practice Manager at the Confluence Collaborative at WashU. I am the chair of the St. Louis NAACP, St. Louis County Healthcare Committee. I am one of the committee members on the Rapid Response Team Community Fund Decision Committee. And what else that's necessary? Oh, yes. That's when I started ETC. That's why I got here. And I am a board member and a program committee member, chair of the program committee of the Haven of Grace. And so I wear many hats. I do many things in the community to help the community. And it's on purpose. I am a busybody, yes, but I'm a busybody because I want to touch and impact as many people as I can with the resources that I have. And so, yes, I get involved in all things so I can know enough information to spread the information. I think access is very important and awareness is very important. And if we don't have that, then we can't get that, right? So that's one thing. Recent joy I've experienced, I think this last 7 months. So I've been jobless and got a job back, and I moved, all things, new area, new appointments and awards. So the last 7 months have been that, and that's crazy to me because life could change like that. So those are my joys, and then also to be in rooms with so many people that have the same mission and vision of helping each other. I love to see, I know that we're going through trying times, but I think that it was necessary for us to unify. And so now, as I'm seeing us come together more for the people, to help people, is really a joy for me to witness and experience this in our stage of life. Because you know we're going towards a downhill where people don't care anymore, and I'm always in rooms with people that care, and many rooms with people that care. So that's a joy for me.
Hello, good morning. My name is Krista Chalise. I am with Seed St. Louis, formerly Gateway Greening. We help support school and community gardens, orchards, and urban farms. And my personal joy was last night, and also about my child. So my daughter is 6 years old. I don't know if you have a 6-year-old, if you are aware of K-pop demon hunters. Okay. I am so jealous of you. That's okay. Anyway, my daughter lives and breathes those songs, and Golden in particular, and she sings it every day on her way to school, and she pumps herself up. And then there were whisperings at home of like her first grade choir concert, including Golden. So then she needed to practice more. And last night, you guys, was the first grade concert. And she sang Golden. She was front and center, and she held her hands together and she belted that song out. And she was living her best life. And it was really, really fun to watch.
All right. I won't be long since I walked in tardy. I was assisting my staff with setting up for our food giveaway, but I'm Shauna. With Northside Youth and Senior Service Center, I'm the Senior Program Director. Two of our main programs is our meals programs where we feed seniors and those with disabilities, thanks to the collaboration with SLAY, and then also high school assists with some of that as well, our hot meals, and then transportation for that same population. My 1 and 2 is about the same. My personal joy and experience in May, being in a vehicle that was completely destroyed while I was taking participants that ride our vehicles back home. We got caught on Kings Highway, right passing Delmar. Vehicle was completely destroyed. All the windows blew out, and I'm still here. I walked out with just a scratch from the glass. I'm excited because I got to see my 11-year-old turn 11, and now my 9-year-old he'll be turning 9 on Friday. So that's my professional affirmation and my joy to still be here, still doing the work, because I know he kept me here because there's still work to be done. And I'll pass the mic on that.
Good morning, Craig Schmidt, Department of Health, City of St. Louis Government Services Analyst. And our vision for the City of St. Louis Department of Health is an equitable community achieving optimal health for all. Not a big step, right? It's a huge step. So we're a public health, core public health department, assessing, assuring, and doing policy development. I will tell you from affirmation, seeing people in this room and elsewhere come together in very difficult circumstances for SNAP and not being afraid, not being stymied at all. It was amazing and gratifying to see that. And my personal joy is we're moving into the holiday season, and for about 16 years, I've been doing a cappella singing in costume, in harmony for children's charities.
Hi, I'm Sharon Riney, and a recent personal joy that I've experienced is that I've been able to be in places where I can help people. And I wasn't expecting that. Being able to contact people and be, oh, I'm sorry. In any case, yes, Deanna contacted me after I lost my job on May 16th, and 2 hours later, I'm watching a tornado skip past my apartment. There's been a lot that's happened, but of all the people that I was, that I knew and was friends with, it's like, it was the biggest joy and most unexpected joy to have Deanna contact me and say, we appreciate you. We appreciate your talent. Can you help us out? And through that, it's like each one kind of takes care of the next person. And one of the people that I met, who was a guest of hers, ended up needing help after SNAP cuts. And because of her introduction, by chance, it's like I contacted the woman and her son, and we were able to get them help. And I could not have done that had I still actually been working. So in a strange way, it's like it all worked out. So anyway, here I am. I do graphic design, I do photography, and websites. So, and thank you both so much from the heart.
Now we invite folks online if you want to share. I'll start with Janet if you are on and want to share. Oh. Or anybody, Janet, Seth, Sydney, Cindy, if you would like to share, introduce yourself.
Hey, good morning. I'm Cindy Mentz. I'm the CEO at TrailNet. And so my greatest joy is just seeing this group continue to meet. I've been a part of this group since we were called BRIC and under a different source of funding. So I'm happy to see you all still meeting. And my professional joy is actually this morning at the coffee shop. Excuse me, I'm not there because I don't want to make everyone sick. Somebody that asked me, what TrailNet does this time of the year, and I was like, well, we're busy planning and developing our schedule for next year and our legislative priorities. And then he just acknowledged how important our work is, and he said it was really influential in making St. Louis a place where people want to stay. And so, to me, I really appreciated that moment. So, thanks.
Thank you, Cindy. Seth or Sydney?
Good morning, everybody. My name is Sydney Gossick. I'm the Director of Strategic Initiatives at Food Outreach. We were so grateful to be welcomed into Empower Thriving Communities very recently. So this is my first meeting. But Food Outreach provides free medically tailored nutrition services to folks experiencing food insecurity and living with HIV or cancer. We're located downtown St. Louis, across from Pappy's. My personal joy is I yesterday closed up my beehives for the winter, so they're all nice and cozy, ready to overwinter. And professional affirmation, Food Outreach is doing some really exciting research projects, and so we're hoping to share more about this with this group in the coming months and connect with you all. So thank you for having me, and I'll pass it over to Seth.
Hi, everybody. My name is Seth Hamilton. I'm the CEO of Go International. We're an international nonprofit that's headquartered here in East St. Louis. We teach marketable skills in education, entrepreneurship, and athletics. So we have a foreign language school. We have a business school. We do financial literacy. We do STEM with drone building, aviation, and then obviously agriculture, which is how I got connected to Deanna. Actually through some of our our volunteer language teachers from WashU. My personal joy actually is a professional joy, although I have a separate professional joy or affirmation apart from it. Over the summer, we got to onboard 7 of our former students of our programs who are now running programs in the absence of 21st Century that got cut over the summer for our school district. And we came to find out that the school gave us 75 kids that had behavioral disorders. And my staff that are all, again, former students, watching them continue on in the next generation, were able to reverse most of their behavior within a month and a half due to the way that they wrapped around them. So I'm just very swelling with pride, especially having walked through the fires with all of them when they were younger, and watching them teach in the next generation is really just very inspiring and humbling. For a professional affirmation, over the last 7 years, we've had an international agriculture project around a self-fertilizing corn seed from southern Mexico. I found out in September that our partners that were growing it in Honduras, they had lost all of the seed, and then recently had been connected through someone we met 4 years ago in southern Mexico that is now giving us continuation and exporting the corn seed to our partners across 5 countries. And we actually have a contract coming up with a biotech company to develop an organic, environmentally friendly fertilizer solution out of it. So we're very excited, and that's going to bring in hopefully funding for all of our projects locally and around the world. So we're very excited for those things. So gracias, Diana, por tenerme de nuevo. Thank you guys for having me here.
And Janet, if you're there.
Hello, my name is Janet Lewis, and my organization is Rustic Root Sanctuary, a 501c3 farm in Spanish Lake. We feed our community. Today we're having a diaper drive. Deanna, what are the prompts? I'm so sorry.
What is either a personal joy that you recently experienced or a professional affirmation?
Okay, a personal joy that I recently experienced was actually I have an executive assistant. So I've been looking for this person for what, like 5 years now. And so I'm so excited that she is here with me to help me do this work that is feeding our community. And she is a Spanish Lake resident, so it's a perfect fit. And I'm just really excited to have someone in the office with me. We have a couple great projects coming up. We're doing two like major infrastructure projects, a North County Harvest Hub and a farm stop. And so this vision of creating a strong micro food hub is really happening up here in Spanish Lake. And so I'm really excited to be bringing that. And I guess that's all I have. Thank you.
Yeah. And lastly, I'm Brittany with IHN, also help co-lead ETC. And professionally, it fills my spirit to always be amongst you all. I love your faces and your stories, so thank you for allowing me to be a part of your lives. And then personally, I don't have any children, but I have a fur baby, Atlas. And I love him so much. He's a bully breed, and he is the silliest little fur child. And recently we've been going to different parks, and so I've been enjoying that, exploring different parks with him. I am? Okay, thank you. Well, you know, I'm a fur mom, so I got all the pictures if you want to see that cute boy. Alrighty, so now we're going to transition to our CDC REACH update. Many of you know about the grant, but we want to make sure that we're providing consistent updates so you know what's happening and kind of different ways that you can plug in the upcoming year. So CDC REACH stands for Racial and Ethnic Approaches to Community Health. It's a 5-year grant that we were awarded in 2023. IHN, TrailNet, ThriveLink, and Washington University School of Medicine all received the grant, and we were able to also funnel funds to support the collaborative after the ending of the BRIC grant. So the purpose is very similar to the BRIC grant for many of you who started with the collaborative from the beginning. And it's really to improve health, prevent chronic disease, and reduce health disparities by making healthy food choices easier, physical activities safer and accessible, and then scaling our Family Healthy Weight program. Our priority populations is, of course, the St. Louis Promise Zone, Black and African American folks. Oh, sorry, and Hispanic and Latino folks. All you have to do is stop, share it again. Sorry. Zoom friends. Oh. So now I'll talk briefly about nutrition, the nutrition strategy. John was unable to be here today, and Jessica is at another session that's happening right now. So Deanna, feel free to jump in wherever you like if you want to. So some of the goals for the nutrition strategy is to make sure the first one is food service nutrition guidelines. So really making sure anyone who is a food distribution site are following the CDC federal guidelines and making sure that the food that's being provided is high quality and expansive to reach community. The second one is the fruit and vegetable voucher incentives. So really thinking through how do we coordinate existing efforts to making sure that folks have the resources that they need, particularly when we're talking about public benefits assistance programs. So the first two are the required goals stated by the CDC that we must meet every year. The last one is the one that we put and we hold CDC accountable to supporting us in, and that's to support and strengthen our localized food landscape in St. Louis. So how are we making sure that we're continuing this table and supporting your respective organizations as well as the broader coordination of our efforts? So here are some of the activities that we have accomplished from 2023 until now. I won't read through all of them, but we were tasked with identifying and completing a food landscape review and thinking through who are the key players within the food landscape, and we know that that's folks here in this room, and how do we make sure that we are supporting them with their organizational and needs, and also what community needs are. And then we were also tasked with assessing policies and practices for our food banks, pantries, kitchens, gardens, to making sure that they are up to date on the CDC guidelines, as well as having additional resources to build capacity to support community members who need public benefits assistance or additional resources for food. And so we were able to do that. As well as coordinating with local level efforts to address food insecurity. So many of us have been a part of other tables, other convenings to coordinate all these efforts. So many people have different happenings, different tables and such. And so we're really trying to figure out a way that ETC has a voice in those tables, and people are truly understanding what makes up the full food landscape. And so here are some successes and challenges. So 8 member organizations from ETC were able to engage within the REACH goals. 2 organizations were able to implement or adopt practices that meets food service guidelines, and 8 were able to enhance their processes to expand capacity. So that what that essentially means is those 8 they are currently working with ThriveLink to support community members in public benefits assistance navigation. Our mini grants. So part of the, as I stated earlier, part of the ways that we hold CDC accountable is to make sure that some of the funds are being redirected to support this collaborative to build capacity for you all. So for the first 2 years, we were able to circulate $97,000 within the collaborative to support emerging or existing projects that you all may have. And then Empower Thriving Communities Collaborative, we have undergone so much in the past, since 2021, and also since 2023. We've reestablished who we are. We created a new name for ourselves, a mission statement, launched our strategic priorities. So we are really going and emerging as fast as we can to really establish ourselves and as a food hub for St. Louis. And then we've also had a lot of opportunity for media coverage. We've engaged in different webinars, speaking engagements, in the APHA video.
So I don't know if you need to like get it closer to your mouth.
Okay, I'll try. Is this better? Probably. And some of the challenges that we have experienced for the nutrition strategy is thinking through organizational capacity. You all are working so hard, and so we understand that being a part of this grant too adds another layer of tasks and activities. So that adds to your capacity. And then so thinking through how do we best support meeting the grant goals, as well as addressing your organizational needs as well. Referrals, we would like to have more referrals to ThriveLink, so that's something that we'll be looking forward to for 2026. The executive orders were a huge challenge for many of us in this room, and I would argue not just professionally, but personally too. And so we recognize that. And then various crisis mobilization. So because of the executive orders, there was a crisis. We had to mobilize around that. The tornado was a crisis, SNAP crisis. So being hit with so many crises, we recognize that those are challenges to you, your organization, our grant, and just being able to progress with the work in general. So for 2026, we would love to start exploring healthy eating research as another component to the food service guidelines. I think that food service guidelines is important, and I think that healthy eating research is much more our speed and our language. It matches our value set, and so I'm really excited about that. We are thinking through how to enhance ThriveLink's platforms to better support you all and community members, and then launching a community storytelling / photo voice activities. And then how does partnership look with ETC? Really thinking through how do we advance our efforts within food service guidelines, healthy eating research, and fruit and vegetable vouchers. And then expanding the grants focus. So how do we continue to hold CDC accountable to supporting this collaborative and rethinking the way that they view food and food landscape and who those key players are. And now I'll turn it over to Eric to talk about physical activity.
Thank you, Brittany. Just give me 1 second here. I have some notes. Are we using this keyboard, Brittany? Okay. Okay, so yeah, as Brittany kind of already mentioned, TrailNet is one of the financial agents for this grant, specifically for community design for physical activity. And I'll tell you a little bit about what that means. So, you know, a number of years ago, the CDC sort of changed their approach to promoting physical activity from a more program-based to altering the built environment to make physical activity easier and more inviting for folks. So they call that, you know, community design for physical activity. And the goal ultimately is to create active, friendly communities that are welcoming, safe, and convenient places to just be outside and being active. And I've made this little table here to show the basic approach to that is trying to connect at least one thing from column A, if you will, activity-friendly routes, with something in column B, everyday destination. So, you know, changing how streets are designed or adding infrastructure for active transportation users like people walking and biking, and then thinking closely about, you know, the rest of the built environment. What are the destinations? How can we engage in things like land use planning, or, you know, working with folks that are trying to develop parks and things like that to have destinations for people to walk to and enjoy. Wrong computer. All right, so and for the activities of 2023, 2025, I don't need to read these all, but we are essentially trying to combine a combination of working with local government, planners, elected officials, to educate them about safe streets, to advocate for better policies and plans that are going to produce those types of infrastructure. And on the other hand, working with communities, community-based organizations across the entire Promise Zone to do community listening, understand need, and then also educate, inform, provide technical assistance. So, you know, letting people know what are the guidelines that they would have to follow if they wanted to make an improvement near their farm or their garden, you know, get a crosswalk installed. Something simple can take a lot of complicated steps. So that type of technical assistance and information. So for our successes, I would say year one, our success was just trying to figure out what our work would look like. That was when I started at TrailNet. And so it was a lot of discovery and focused on identifying community need. But over the course of 2023, 2024, and 2025, we've had quite a few successes, particularly in St. Louis City in terms of policies. So for example, Proposition T in November of 2024, we strongly advocated for this referendum that establishes a citywide Department of Transportation. If you know, in St. Louis right now, things are very divided between different departments and they don't always work well together. So this will be really important in increasing efficiency, centralizing funding, and making planning for, you know, comprehensive street safety a lot easier. Similarly, Ordinance 71-882, the city's complete streets policy was updated in 2024. So now there's a lot more robust regulations around anytime you're going to be doing something in the public right away in the city of St. Louis, you've got to think about ADA compliance, you've got to think about bikes, you've got to think about transit, you've got to think about vulnerable road user safety. And that also established a complete streets committee, which is publishing reports every year. So it's going to include a lot of transparency, which is a service that we help to provide. So it's a little bit of a lift off of our shoulders. But, and then, you know, I think one of the biggest things to recognize is we fought for some of the ARPA money that the city had to be used to increase street safety. Traffic violence is a huge problem in St. Louis City and St. Louis County, and in particular in the Promise Zone. And so $46 million in funding to go to over 30 miles of principal arterial roadways, you know, your Kings Highway, Grand, Goodfellow, like a lot of these roads that have been the deadliest in our area, in our region for so long. So that's and you could see it happening, it's happening out there. And then we also worked in a number of ways with the city's Department of Planning and Urban Design, the Planning and Urban Design Agency, on the Transportation and Mobility Plan that just was adopted last week by the Planning Commission. They voted on it. That's our first comprehensive plan update in the city since 1948. Just so to say that that was long overdue is absolutely an understatement. And we helped really push for things that we advocate for in that plan, but also help with community engagement and things. And I'll say we're very happy overall with the comprehensive vision that sets us on in the city of St. Louis. But for me, as a community planning manager, sort of the most exciting and fun work that we've done has been in the areas of working with communities on neighborhood planning processes. So our REACH grant coincided sort of serendipitously with the city's Plan STL initiative being launched, which if you don't know about it, it's a program to get every single neighborhood in the city of St. Louis their own local community-driven development plan to shape the future of their neighborhoods. And we worked with planning areas 1 and 3 predominantly in 2024 and 2025. So that's the Ville, Greaterville, Kingsway East, North Point, and Baden neighborhoods. And we've also been working a lot with the We Collab resident-led neighborhood development plan, which is really what kind of inspired in a lot of ways the city adopting this kind of neighborhood planning policy. So the West End and Visitation Parks neighborhood, that plan was adopted in 2023. So we've been working with them on implementation efforts, applying for funding, narrowing down the scope of their adopted plan to really focus on particular intersections and corridors and where we can improve street safety. And then in terms of our outreach and education related activities, in addition to educating policymakers and getting some of those policies passed, we publish an annual crash report that it looks at the most dangerous streets in the St. Louis City and St. Louis County areas. And last year we took a really close look at the Promise Zone. So we assessed 10 years of crash data, focusing on vulnerable road users in particular, and highlighting where we think changes need to be made, and also highlighting the fact that traffic violence, while it's a problem for everybody, is really concentrated in certain parts of our region. And the Promise Zone is the primary area where a lot of that traffic violence is taking place. So with that in mind, we did a case study of traffic calming on Natural Bridge. A lot of people don't love it, but what we showed is that, from the 5 years before and the 5 years after, crashes are down 79% on that segment of road that MoDOT put traffic calming on. And that's 41% decrease in pedestrians being struck by drivers. So it works, and we want people to know about it, and we want communities to support it. Look, nobody wants to be stuck in a traffic jam. Everybody wants to get where they're going as smoothly and easily as possible. But this stuff really works, and we're happy to see the city and MoDOT and other folks actually doing this work. So and then the last thing is our Complete Streets for All campaign. So with a little bit of REACH support and support from Missouri Foundation for Health, we are sending an outreach team out to hundreds of events a year. We are educating people about traffic calming, about what complete streets are and why they matter, the economic, the health, the joy benefits that these bring in addition to safety. And we've been partnering with other organizations that align with this goal. So this year we had an event with Paraquad. The mayor was there, and board president Megan Green was there, and a number of other folks. And so we're really trying to, bring, just like this organization does, bring more people to the table to be able to fight for what we all deserve, which is being able to go outside of our homes and get to where we're going safely and comfortably. So just a couple pictures here. What does the community planning look like? So we get to do a lot of fun things. We've done a number of these traffic calming pop-up demonstrations where we can show people what it would look like, talk to them, describe what these safety things mean. So we did 4 of these in the past year in the Promise Zone, and we've also been collecting data so people can tell us, where do you want to see this kind of stuff happening? And for forecasting 2026, I think we really want to, as these plans in Area 1, Area 3 are getting adopted, continue to work with the city and with those community-based partners and get some of those great ideas that residents have put a lot of energy into providing us, get some quick wins. And I say quick build wins. There's ways that we can, get stuff for street safety built that doesn't take 10 years or $10 million. And so we're going to keep pushing for that in the West End, Area 1, where these plans are being adopted. And we're going to continue to partner with the city on those ongoing areas that they're starting in new areas every year. TMP was adopted, like I said. We're going to do the same kind of thing with the neighborhood plans. We want to work on some quick wins of implementing that, expanding our education around what that means and what communities can do. And then also, my colleague Sam mentioned, she runs our Safe Routes to School program. I'd love to see more integration with our school-based work. We work at Hickey Elementary School and Walbridge Elementary School, which are within our footprints. And I think it would be really nice to connect those efforts. So in addition to that, for ETC partnerships, I think like being able to have discussions about what the new transportation and mobility plan or the plan STL processes mean and how we can connect transportation and mobility goals with other goals that are health and safety focused. And then also just finding out, these are ultimately projects that should be place-based. And so most of you are place-based organizations. And so I see this as a great opportunity for us to host events like those pop-up demonstrations or, to have our outreach team coming to events and where we can start listening to people and turning the needs and ideas at these place-based organizations that you all have into some advocacy for actual plans and improvements that we can push forward. And with that, I will give it back to Brittany. Tina, thank you.
Thank you. So obviously I'm from our part of the program is the Family Healthy Weight Program. Obviously I'm not Denise Wolfley. She was unable to be here. So bear with me as I fly through our slides here. So our goals are to increase access to family-based behavioral treatment to address childhood obesity. We know it's a growing problem and a lot of people are not quite sure how to fix it. So our program is to help families and communities do that together in a healthy way and a way that isn't stigmatizing and doesn't create bias, because we all know that's there. Our other goal, one of our other goals, is to ensure that the FBT program is culturally congruent and responsive to the community needs and experiences, because everybody views food and eating and body image differently, and we want to make sure that we're addressing the community that we're in. The next goal is to expand capacity and service delivery through partnership with federally qualified health systems centers. So our program is not necessarily in a community organizations, it's more in the clinics. We're working with the physicians and the behavioral health specialists to educate the families, to help them with cooking. We do cooking demonstrations and we have cooking classes with our families. We talk about ways to take the food that we have in our pantries and make it fun and make cooking a family thing, as opposed to mom coming in and having to do all the work, teaching the kids to help participate in that. So some of the activities that we've had this year is we have been working with the clinics and the providers here in the Promise Zone to bring this project into their clinics and train their providers in the Family Healthy Weight program that is CDC recognized and is approved by the AAP. So, we found that it really works. My boss, Denise Wolfley, has been doing this for 20 years, 30 years, and we want to make it work for everyone, not just the few people that can get involved in a research program. So we have been working with the Missouri HealthNet director, Eric Martin, to make this treatment available to people on Medicaid. We are working with them to make sure that providers are trained, that are qualified, that they know what they're doing. And also, due to the shortage that we've had with community health providers, we're allowing dietitians to become involved because they're a little bit easier to get a hold of in some areas, and as opposed to a licensed social worker or a psychologist. We are working to make sure that the program materials that have been invented over the last few years are relevant to this community and to the people who live into it. We are collaborating to adapt those materials to fit the Missouri benefit that came out in the last 2 years so that communities and clinics can get reimbursed for the treatment. So which makes it more feasible for the qualified health systems to provide the service, as opposed to say that's not something that we can devote our time to. So I'll not go through all of these. Some of the successes we've had is we've been we're in the process of training 2 clinics right now, affinity and family care systems. So we're very excited about that. We have made significant progress on taking this program digitally so it's easier access, taking it to telehealth as opposed to families having to come into the doctor's office to receive treatment and to go through their sessions. So that has been a really big goal because we feel it's more feasible for families to be able to do a telehealth session over their phone or their computer, over their tablet, as opposed to having to find that transportation into the doctor's office. We are using, we met with community stakeholders here in the Promise Zone and got feedback on our program, how to advertise it, how to work with the community, and really get buy-in from the community because we feel it's really important. We need to make sure that kids stay active. We need to make sure that everybody that involves the whole family, because if you focus on one person in the family, you're going to not have as much change as if you can change the entire family. And that's really the goal of this program, is to work with that entire family and not just say one person needs help and needs to change their behavior. We are, some challenges that we have really faced is community behavioral health specialist providers in these clinics are busy with so many things going on in the world right now, and mental health being a significant crisis right now. They are packed. So again, we've been really trying to dig out time from them away from some of the things and allow other people to assist with this program. And that's why we've been working with Eric Martin to say, let us have dietitians, let us have community health workers to help with this. And, you know, this would all be overseen by the professionals, but let us get more people involved so we can serve this community and help this significant crisis. So our goals for the next year, finalizing that digital platform to be available for more people, making sure that all of our materials are reviewed and are culturally relevant to this community and to what's going on in today's world, because we know it's changing. Also to make sure that we have a package that the clinics can get reimbursed for, because we really think that that's where the buy-in with our clinics is going to come from. They have to, as much as they want to serve the community, they need to be able to be financially solvent, and this needs to be sustainable. So that's why we've really worked with Medicaid and to make this program that way. As for our partnership, we're not sure what we can do with you, but we would love to hear what we can, how we can help, how we can integrate and work with your organizations to make our program better. We have a few more restrictions in, you know, where we can deliver our program, but if you have ideas, we want to hear them. We want to be able to, you know, work more with the community and make it more available to more people. So that's our program, and we are really happy to be a part of it. And it's been really nice to be here. Thank you. Tina Day, and I work for Washington University.
Thank you, Tina. Quickly before questions or comments, if you don't need permission, but if you would like something to eat or some more coffee, please feel free to get it. They're going to wrap it up around 11. So if you want another little something to nibble on, please.
That's what I'm proud of. The picture that I had up there was from Gabby's daughter.
Yes.
So that is an example of like that crosswalk that you demonstrated there. The farmer's market. So combining street safety with. I'll echo that. I think. Like, since 2020, and I really understand it more in the year. I can see that we do a lot of community engagement. We do a lot of canvassing in that area, and the residents want to come to the space, but they want to feel safe walking. So, and it's a lot of elder and it's a lot of people with kids. And so I think a full circle having you all at the space that weekend was nice. So yeah.
Any questions or comments for our presenters or about REACH in general? Okay. All righty. Well, you know where we are to find us, and we will continue the work for the new year.
Okay, thank you. And another plugin before the break or before you have to leave, if you have to leave before, make sure you grab a t-shirt and a hat. Don't leave with that one. Yes. And very briefly also before we continue with the presentation, through Andweli, we were connected to Food City, who also runs a beautiful digital book and program, and they also have a podcast, and I see some of you have already been in that work. They are working on releasing a resolution with the other woman, Daniela Velasquez. So in your tables, there are copies of the resolution. This resolution is to declare food as a human right for the city of St. Louis. The other woman hopes to launch it on December 5th. And they will love the feedback from all of you. It's the other woman, Daniela Velasquez, from the 6th Ward. So just as a summary, yeah, we're not engaged with that, but we really wanted to use this platform to get the community voice. And they are basically declaring 3 core responsibilities. The first one is to respect the right to food. So avoid policies or practices that make access harder. Protect the right to food, which ensure others, such as landlords, employees, developers, and systems, do not interfere with people's ability to access food or create harm. Well, that's worded wrong, but you know what I mean. Fulfill the right to food. Invest in and coordinate the systems, which includes wages, land use, transportation, local food production, public health, emergency response that make reliable food access possible. So we're also going to be emailing you this. Don't worry if you didn't get a copy, and send the comments. We will convey them to them. And I think they're hoping to do an event on December 5th to launch this.
Comments back to you.
Yeah. And we can also copy Sarah on the email, so you can send them directly to her. But that was it. That was it for this little thing, which is exciting. It's just never been done before in the city. So.
And she also said that she's hoping to replicate this into the county too. So this will help be that pilot to show that this is needed for the county as well.
All right, so very quickly, because I know we're really short on time, but it was necessary to have that space for everybody to check in at the beginning. So in the retreat today, we really want to focus on establishing community agreements and also on our membership agreement. So as you can see, this network keeps growing and growing and growing, right? Like back in 2020, 2020, it was like 6 of us or 5. And because of that, we with Brittany, we really saw the need of also having membership categories. So on your tables, there are copies of the community agreements and the membership agreement. What we want to focus first is the community agreements. So do we have them on this slide or no? Just do them on the paper?
So we don't have physical copies of it.
Okay.
Sorry, friend. But we were hoping to be able to walk through it together on the screen. And I have to reshare. Hold on.
So this was necessary because of the work we've been doing, right? It's also kind of it speaks volumes that over 5 years that we've been together, no one has left the collective, but we don't want that to happen, right? So we need community agreements. We need a framework where we are working with reparation of harm if it happens, right? Increasing our trust, increasing our collaboration. And that was what went behind proposing some of these, but we really want your feedback. And maybe you know other community agreements that you would like to have or see some that are missing here. So
yeah, so these are just some agreements to start with. If you can let us know what agreements that you would like to have incorporated within the collaborative, and then thinking through what agreement is missing. So what do you need from every person in this collaborative to feel safe, to feel supported, open, productive, and trusting?
Of the community agreement that says like one voice, what is that?
Essentially, that means if someone is speaking, please don't speak over them. Allow them to finish speaking, let them get their thoughts out. One mic, one voice. And if that's something that we do not want, that is fine to say too. Yeah.
No, I thought it meant like someone.
like we're just one voice. Kind of. I've also heard it name as the practice of resonating, which is when you're resonating, you're really listening or deeply listening, right? Maybe we can reward it like that. It's like deeply listen. You're not trying to up the person or cut them in the middle of a sentence. So maybe we can reward it better. One love. Any others? And we are going to email this to you. So today we really just wanted to lay the ground, introduce them. These are the ones we're thinking about, because when you complete your membership agreement, you will abide by this, which is why we need them as a collaborative to agree on them and develop them. Yeah? And on line 2, if you have any comments or any ones that are missing.
Already, how do we respect differences? Meaning, like, respect consensus at all times.
Yeah. Cool. You said it. Remember when we had that meeting, healthy competition? Was that the word you used when we met with you?
Oh.
What was it? And that resonated with me so much because in this space, all of you, and all of us are always fighting for funding, right? And struggling and competing. And there's a good balance where you can do that in a respectful way you can honor your opponent, right? Like in a very Japanese style way where you respect what the other one is bringing, recognize the differences, see the value in their work. So maybe somehow we can include that. And I don't know if that's kind of what you were.
Exactly.
Also, this group is very, is not just food, right? We have physical activity, we have social connectedness, which came from our origins, from our initial funding stream. So, and I will continue to advocate to do that, because we can't solve the problems by ourselves, staying in our own lines, and because of that, we need even more emphasis on how do you collaborate when you don't even have the same mission.
Any other thoughts? Anything missing from these community agreements? Anything that does not resonate that you want to discuss? Yes.
I'll just say I think need more time to process. Is there anything that you would like a deadline of when you want to go?
So we are hoping to, because we're meeting again in February, right, for our visioning retreat. This is kind of like our taking stock, setting the ground, planting the seeds, and then in February, we're gonna do our harvest. Yeah, we're opposite. Our visioning retreat. At that retreat, we are coming together again, and I would say before February. So it's February 19, I think, or next one. Yeah, so before that time, for sure. And then by then, maybe I should now go into the next slide, which is the membership agreements. I don't know where, oh, you got it.
Before we move forward, if anyone does have any other thoughts, happy to take them now.
I just think we need to have mutual respect for the business. And not, to avoid getting fighting, even though we are often going after the same dollars. But that we just have as
yeah, what we're doing is very unique. It's a table that combines different sectors, and that's not done. So I understand why some of you are very protective of your own, again, expertise, because that's all you know. But I'll invite you to stay open, to see the possibilities, look at the work that TrailNet did with Gabby. They also did the same work with Fatima when she, I don't know if she's still a member, but with Be Well Cafe. You did it with Erica as well, right? It's increasing safe, or with one of the senior centers. And that was before.
Yeah.
So anyways, stay open. It's the future. Trust me, we're not gonna survive if we stay just in one thing.
And I think what Keisha said is important. And at some point, probably not today, but during the visioning retreat, I think we will definitely need to dive in deeper about what that actually looks like, because we can say that, but what is our process and kind of code to follow to make sure that that's being actually implemented within our collaborative. And so I think that these community agreements help kind of prepare us, as Yana was saying, to dive deeper into that. Another thing that was on the other slide was talking about conflict resolution, or so there's some things, because of where we are in the collaborative, we're really trying to figure out what does formalization look like. There are some things we really want to try to get ahead of and think through processes for. So conflict resolution, mutual respect. That's why we also have our internal capacity building work group to think about funding and what does it look like for folks to collaborate together. How do you go about that process? So there's so many things that we are excited to be able to figure out together. So any thoughts that you have, we welcome. Go ahead, Lacey.
I'm like echoing what you said, but like from my own experience being working with a lot of different groups here in St. Louis, networks here in St. Louis, I think having a policy for conflict resolution that we're signing rises? How are we making sure that we're like honoring everyone that and like harming this network?
Absolutely. And I think there's already some of that in the agreements in the tables. So we're definitely going to make sure to, sorry. We'll keep talking very close into the mic.
Anything else?
Anything else? Yeah, you'll have time. You know, you'll take this with you. I will email them and you can give us feedback. All right. So going back to the membership agreements now, which will cover some of that, what you mentioned, Lacey. So we thought that it made sense to break our membership in 3 levels, right? So we have members, which are individuals and organizations who are working or representing the food systems landscape, working to advance food equity and justice. We also have the larger network, which are individuals and organizations who complement the food systems. So that includes other sectors by providing services to improve health and wellness. And then we have supporter level, right? Which are individuals and organizations who support the vision, mission, and strategic priorities of the collaborative. So when it comes to our mini grants, for instance, since 2020, we have only prioritized and given funding to organizations that are doing the actual work and have smaller budgets normally, but we wanted to make this more clear, which is why we wanted to create the agreements. We also didn't want to impose it. So, you know, we already know that very identifiable. Some of you are definitely members, some of you are part of the network, some of you are supporters, but we wanted to give you the agency and the decision to see, where do you see yourself? Where do you see yourself in this group? Do you see yourself as a member, as a network, or as a supporter? So those agreements are on the table. They also have some language around, you know, the community agreements and what you mentioned, Lacey, around liabilities or, yeah.
And if I can add, so by no means are we asking people to sign this today. This is just a draft language of what the agreement can look like per the respective category that someone would fall into. And also, because of the current crisis or the SNAP crisis, this role delegation could have been also helpful for us to mobilize even quicker in thinking through what is everybody's actual responsibility. Who are the members who are doing the food that needs to be prioritized? Who is our network folks that can help make that happen even quicker? So Eric had offered TrailNet services and being able to help think through what is the most accessible sites for distribution. Jessica from WashU Center for Public Health System Science helped create the one pager for ETC for the SNAP response. So mobilizing that way, and then for our supporters thinking through from that landscape, is there funding opportunities that they can help provide? Is there other resource, data, policy? What are the ways that they can provide? So we know that from the beginning and preparing ourselves, and it doesn't have to be crisis, it's just normal, everyday, collaborative things. But the crisis really highlighted the importance of us really needing a bit more structure and clarity on roles. So yes, as Deanna said, on the table, these are examples of the membership agreements for a member, a network, a supporter, and we also welcome your input on what the agreement is, like what it looks like, what's missing.
Are we to fit in only one category?
I would say yes, because then it will make it more confusing. Melanie's question was if we could only choose one category, and I said I think yes. But also we will email this to you, and you can provide comments on even on track changes or however you. And if you have examples as well of other collaboratives, again, because we're kind of creating this from scratch. from the experience we've had.
So any initial reactions to the idea of proposing this structure for the collaborative?
Any initial reactions to the idea? Okay. And any reactions, even online?
I think we should also like highlight engagement too.
Highlighting.
I think somewhere along this structure, we should highlight engagement. I know that some groups are able to like be more engaged in this space and allocate time from their work and show up a little bit different than others, and that's okay. But I think that could help as well further define like the structure.
So engagement, and sorry, I was saying.
Engagement for its time, showing up.
Yeah. That's definitely our agreement. And we might modify some of them. I think we had attend at least 50%, but we might increase that for the actual members because we need you, you know, and the reason why we reduced the amount of meetings that we met as a group was to decrease the load on you. I know you're doing this, you know, you're basically volunteering for this and you're all very busy. And that's why we have our committees, right? We have our 3 committees. We meet regularly. So it is another way to re-engage you in the work and know that, you know, you can be in any of these categories if you are part of any of our committees. Any other?
Because I'm just thinking a little bit about with TrailNet, especially how like Eric's work is more in the member zone, whereas maybe TrailNet as an overall would be network or something like that. I wonder if there's a need to kind of delineate individuality and organizational capacity.
Yeah.
I don't know. Have you guys thought about that, or do people have thoughts on that?
So we did play with it a little bit to think through who would actually fit in these structures. And as Deanna said, we wanted to give that ownership and autonomy back to you all. For TrailNet, I would see TrailNet as a network and not necessarily a member, because in this instance, we're framing members as folks who are food-based organizations, and that is their mission. That is what they do. TrailNet is complementary in supporting people to get food and helping with additional resource to food-based organizations. So that's why I would consider them to be a network. Still a member, but like you're part of the network. Yeah. Yes.
Makes sense.
In a member zone that they're part of.
It's a matter of like what are the I think this goes to what Gabby was saying. It's that level of individual like
yeah.
Maybe that's a question for us.
Yeah, that's why this is open, right? We want your feedback. Brittany created these ones, and yeah, so we need a lot of feedback from all of you, because you're all members. You're here. You know, you're the network. You're all of these levels, right? Unfortunately, because of situations, we need that structure, right? Because of it would make our response easier.
I think it's a good thing though. Like I don't see it as a bad thing to be able to have role clarity in a group.
I also think it helps with some of the power dynamic amongst the group, not in a like bad or negative way, but more so equity. Who needs the support, who is at capacity but is still showing up, versus if you're showing up and you have the capacity to show up and you have the resources, or if you are like complimenting and supporting the work, but not directly in community, doing like some of the on the ground things that need to happen. And then I also think from a supporter space, maybe we could exclusively like state like philanthropy or like put possible funders or foundations, something like that. I think there's people in a space that have connection to that, or it would help kind of like invite folks. And I think that's a good look for the future, to have possible like foundations and people in like grant making a part of the conversation.
Yeah. Absolutely. And we already have those, right? Some of those, not all of them, but we already have some of those, which is why this structure is also going to be useful for us, because then, you know, they'll see like, oh, this is my role. I don't have to just like go to a meeting or don't go to a meeting. Like, no, you are saying you're going to support us by signing this agreement.
Right, and so you can't come in and say, this is how you need to operate. You are a supporter, so you have to show it.
Exactly.
As
exactly.
a
Yeah, yeah. And we're also hope to be welcoming more people. So, you know, we reach out to Anne's Roots. I don't know if you've heard of it, but she was a member back in 2020. And more people are wanting to join the group as well, which is why we need membership levels as well. So, okay. But again, you know, you'll get these. This is going to be the by February. We will have feedback on these. You will be self-selected into the group that you want to be in.
So, like we said at the beginning, these are some of the other things that we really want to focus on. We won't get to it today for the sake of time, but we want to start the new year talking about more of these things. So thinking about tools for conflict or having some type of agreement in the way that we resolve conflict. Restorative justice has came up. Healing and liberation has came up as also a want and desire for the collaborative. So thinking through what that looks like. Strategic priorities, thinking about establishing co-chairs, and then the timeline. So we have so many beautiful ideas within our priorities, and we really need to figure out what comes first, what is our timeline. And so we're really looking forward to doing that in February. And then also thinking about our food systems hub. How do we build upon the SNAP response efforts? Yes, it was always a plan to get ETC more visible and have us on people's minds. And with the crisis, it just happened so fast. And so now, gratefully, people know who we are. They're excited. They want to support. What does it look like for us to build upon that momentum? So everyone should have the calendar invite for February 19th. We'll come up with the agenda and send that before the year is out. And now we have a 10-minute break. And so we will come back together. Deanna is going to be, if you haven't had your headshots yet, please see Sharon outside this wall. She's doing headshot pictures and collecting any testimonials. If you haven't seen Ariana yet, stop by her table. And for our wellness corner, Deanna will be facilitating a sound bath in the next room down the hall. So if you're interested in that, please feel free. Or if you just need some time to chill or get some work done, please feel free to do that as well. It's at 9. Yes, and also Ariana has so graciously have gifts for us. Ariana, you want to talk more about your gifts?
All right, hello everyone. Ariana once again. So I have handmade herbal tea blends. You get an option between one of 3. So they target different systems of the body. So we have the nerve root tea targeting the central nervous system. So that's a blend. We have the lymphatic root tea that targets the lymphatic system. And then lastly, we have the blood root tea that targets the blood, so the circulatory system. So you get an option between one of the 3, and they're free of cost. So feel free. Thank you.
Thank you.
So my thing is in the next room.
Yes.
Oh, yeah.
You are smaller than I am.
No. Take it.
It's a JK Foundation. I'm part of this coalition.
No. This is
Jackie Jordan's Foundation.
So when Ariana, she came aboard, she was a part of Patient Healing, she is a part of Patient Healing Roots. Also, she was working at JJK. And so, but outside of that, she's no longer working there. So outside of that, we haven't had
Any connection there, just because they're going to be working on, they're building greenhouses out there. They're working on food issues. So I don't know if it would make sense to facilitate another introduction out there.
I think it would. We've also been talking to John Michelle with Food is Love.
Oh, okay.
He's been working with them very closely.
Is he doing that food? The trucks? I have a meeting set up with him for
Oh, yes, with the moms.
Yeah. He's been working with them very closely.
So
we were also hoping to
crappy
get
bags.
reconnected.
Okay.
It doesn't have to be through him, but
meeting with him after Thanksgiving. So
wow.
Yeah. Facilitate another introduction.
Yeah, that would be great. That would be great. So we're supposed to be trying to meet with him again. I know him and Andrele they know each other.
Can I grab a tea?
If I have.
Oh yeah. Thank you for thinking of us and always being amazing. Bye. Thank you for coming. Yes.
And then the meeting on Thursday, that living wellness, that's on Zoom, right?
Yes.
Oh, good.
Yes,
Okay, because I have a doctor's appointment to get my injections. Did you see those things I sent you? I sent you the frozen
I didn't get a
cats.
chance to look at it. I have it. It's one of my tabs that are open.
Good. Well, they have been a lifesaver. And, if you need to, as much as I hate getting 39 shots in my head, it is really helped.
Yeah.
And I can tell I'm ready because I have had a migraine every day this week, but not as bad.
It's I tell my friends all the time, like, I can handle all kind of pain, but not migraine. I just can't do
Well, and a migraine isn't just about the pain, it's about the fact that you can't do the light. Your vision goes funky. You can't handle sound. You nauseous. There's so many things that people just don't understand that go along with the migraine. It's not just a headache. And anybody who thinks that, they need an education.
Right. So true. That's so true. Well, yes, thank you so much for coming and being a part. And I hope people see they're like, what's her name? What's her name? Oh, it's Tina Ray. So yeah, I think that this could be a really great group to help think through, just like you were saying, advocate for the program, but also figure out ways to modify, if we can modify. I know we're gonna talk about that on the 12th, but like this would be that group.
Well, and we did bring up we met with Eric on Friday.
Okay.
So Eric Martin, he is the chief medical officer for Mo Health Net.
Okay.
He said that we brought up the community health workers because of the fact with the shortage, and he was opening to listening.
Okay, wonderful.
So
that's amazing.
If Antoli's working on one end and we're working on the other, hopefully we can meet in the middle.
Yes, that'd be great. Oh yes. How'd you know that was me?
I mean, I said that.
So no points. No, ma'am, I don't. I give them to you, and then you bring me back a bowl. For the rest of the season, I'm giving them free. We don't have many. I probably have probably another week and a half. So last Saturday. Yes, ma'am. Yes, ma'am. Check us out on Facebook. Some great photos. You're not. You're lucky you.
Hello, friends. We are. Hello, friends. We are transitioning to the healing part of the agenda, so I'm going to close down the Zoom. But I'm so happy to see your faces or your pictures too.
Okay. I'll be at the next one.
I can't hear you, John.
I said I'll be at the next one.
Okay. Hi, Emma. Bye,
Talk to you
Emma.
soon.
Bye, Cindy.
Brittany.
Yes.
The Haven of Grace, in the listing for.
I have you all on there, but I never received, I don't think I've received a response about how much you all would need. But I think I made up a number, honestly. I think I put like I just, I didn't know.
Yeah, I mean, because I'm having. So,
What size?
I can't prepare.
make sure I did sign up before I go.
But you were unsure.
So you're here. I made it. And I can do it this
Oh, medium.
Yeah, you sound.
I'm good. I'm here.
Yeah.
It's something that
I really don't have funding. Our wellness, the person who runs the wellness program. Holly Berger. And then Emily Page is our HR wellness program person.
Right, I know.
That's it. So go back to the L. Okay, put a dot. Oh, no, just a dot. There you go. That's me.
Okay, so I'm gonna work.
Yeah. Tina. Day, D-A-Y. Yes, wonderful. Okay.
And then so they're doing that.
Okay, yeah. Oh my goodness. Yes. Okay.
Oh, yeah, you saw me, I was like, because it's so.
I've started taking some meetings that I know I don't have to write in or anything. I'll take a walk and talk because and we really need it today. I mean, the obesity issue.
It is for.
And you know, learning how to they're coming out, you have got to know how to do that. Otherwise, your body, your muscle will break down because you're not eating the right things. Because you could get away with just eating junk food, and it's not eating.
Have you heard of that?
I am.
Okay, let me see.
Okay.
Some of my, these are new things that
And that's what our program is all about, is it's family. It's educating the family and the kids and working together to create that home environment. Oh, there I am. Oh, I was like, wow.
Okay, but I can go through it. But it's a great way to go.
Yeah, because that's what we need to do. I mean, people work too much, they don't focus on their life, and that's yes.
I agree.
Yeah. You too.
Okay, see you later.
And that's why I say it all.
Good. Did you get your t-shirt yet? No.
Hey, it's good to see you.
I wanted to run into you. I know we met like very early on in my time, the REACH grant, and I was very excited about finding ways to work together. Yeah, I think now we're kind of really now. So maybe if you could chat as you're talking about goals for 2026. And yes, you know, I was just talking to somebody. Hey, Children's Hospital does, you know, free bike helmet giveaway. I was like, okay. So yeah.
Okay, everyone, if you're interested in participating in the sound bath, down the hall, Deanna will be facilitating it. It'll only be about 20 minutes. So if you need a minute for mindfulness, a little bit of meditation, you can go down the hall.
Let's do it because how are you? Good to see you.
Down the hall, straight down.
It's just like and what No. Why? Why? Where? Why?
Yes. I like it. I like it. Oh, sorry. I was getting up my sound now, can you, we need to do that. Yeah.
It's good. I think it's I'm glad I mentioned something about Gabby. I also realized I didn't talk about the shoes. I was just trying to get through it quickly. But I thought it was really nice to have her sit for a second and realize that it's probably but the fact that Tiana mentioned are really set expectations. So some of it is just that's architecture and design, starting to do a lot of boards and mapping. And that's something I'm trying to do for SRTS, whatever other project. Things that's great how you say, you know what, I could develop this education resource as part of REACH or as part of SRTS. So yeah, I like the idea of having that. I did, yeah, excited. It turned into a long conversation between Sam and I about winter layers. I should. Yeah. Get her a hat, because then I don't have to think about.
I am. I'm a grad student. Is it? It'll be ready as well.
But no, it's great.
You know. Whatever. You don't care who we are. Okay. I'm very excited.
Straight no chaser.
That's amazing. Hard.
Oh, yeah, that one too.
Are y'all still recovering? You're not gonna replace her. You know, you can try, but you're not gonna and everybody ever into so real down to earth. That's like really.
Oh, really? Now are one trucks, and they are actually out
That's what I'm saying. I don't want to be in the spotlight. I'm not trying to do a solo.
So now it's hard. Oh, north side. Oh, okay. Okay. Anyway, that's so depressing. Yeah, but Wesley House.
That's good. You usually have an important one. Well, yeah. That's really good. That's good. We just shows it in your hand. That's good. That's really good.
I'm moving in. I mean, no, so the way. No, yeah. So we're so So